You're listening to the Business Wealth Impact Podcast, your source for empowering information and cutting-edge ideas from the world's top minds. I'm your host, Jeanne Amlour, founder of seven-figure coaching company, Jeanne Amlour International. Join me on a journey to unleash your potential and create your highest success. Welcome to Business Wealth Impact. Hello and welcome to another episode of Business Wealth Impact. Today we have Dr. Heather Hammerstedt, who is a medical doctor specializing in emergency medicine, lifestyle medicine, and integrative nutrition coaching. She is the CEO of Holist, where they nerd out coaching people how their brains and bodies work with food. Welcome, Heather.
Thanks for having me. So nice to see you.
Yeah, it's great to see you again, too. Little secret, everybody, Heather and I are kind of friends. So we've known each other for about 6 years now, I realized.
We grew up in business together, didn't we?
Yes, we did. Okay, so Heather, please explain to people or just, elaborate a bit more on what you coach on, which is the pillars of lifestyle medicine. What are those pillars?
Well, let me back up just a second and just say that I went into medicine like just assuming that I was going to learn about food and movement and mindfulness and all these things that we know are so important to our long-term metabolic health. And they're doing better now, but I won't age myself. But when I was in medical school, we didn't discuss any of it. And so I went to health coaching school to learn that on the side. I've been kind of dabbling in health coaching over the last 20 something years. And then lifestyle medicine became a certification that you can do in the healthcare system through the American College of Lifestyle Medicine. And it really brought everything full circle to me, which was, what are the behavior things and the real day-to-day things that we need to be doing to be healthy now and in the short term, medium term, and particularly getting to that long-term metabolic health. And there are pillars in lifestyle medicine that we can talk about. I do want to get to the root of everyone's question is what is an emergency physician doing, talking about all of this stuff? Yes, we are the big, bad, dangerous doctors, but it turns out that you only get to me through chance or through long-term chronic disease. And I was getting a little tired at 3 a.m. of talking about metabolic disorders and obesity and diabetes and trying to talk to people about things that they could do now when I wish that I could have talked to them 10 to 15 years earlier. And so it is a lot more integrated than you would think. So lifestyle medicine does have pillars of that we kind of work on. Lifestyle medicine is not just for physicians. You can join the college as a nurse, as a pharmacist, as a dietitian, lots of different ways to join. But basically, the theory of it is really using lifestyle and behavior change as a primary modality for the prevention, treatment, and reversing of chronic disease, by really empowering individuals to adopt and sustain healthy lifestyle behaviors. And that's easier said than done, right? We've all started down the path of making some changes, and then our squirrel brain gets a hold of us, and then we rebel, and things don't work. And so sometimes you really do have to dig into a lot of the mindset and kind of the metacognition around how our brains work and how we make behavior change. And that is where, in your intro, when you say we nerd out about this stuff, is I really am serious about how do our brains and bodies really actually work when it comes to fueling, moving, and thinking and creating the behavior change in our own kind of neural pathways. So that's lifestyle medicine.
Right. And this goes for everything, not just medicine. It goes for business and life. Okay.
Yeah. I mean, you're so right. Is I really think that no one is going to make internal change without that why coming from yourself. And I think the why doesn't happen until you have a light bulb of how your body and brain is actually working with the choices that you're making. So if someone is telling you from the outside, do this with your business, do this with your food, we're all toddlers in these brains. We are all going to rebel. So It has to be coming from within.
For sure. And I love that because you're using that brain science and not just saying, and I'll just interrupt my own sentence. What I love about you is you've never, ever used the words lose weight in your coaching or anything or your content or anything, because it isn't about losing weight. It's about working with our psyches and our mental health to create behavioral change and not just go for, I'm going to lose weight. Right?
Yeah. I think
Yeah.
that the term losing weight is like really, really loaded for a lot of people, especially women. When some of us have been told we had to lose weight when we were 10, 11, 12 years old, and we've been counting and thinking and like really like just like self berating ourselves for some things that are not really in our control. And
Mm,
so I want to create an environment where people, but especially women, understand that adding things to their life can make them healthy, not just
mm,
taking things away. And so I
mm,
think that the idea of restriction, the idea that food is bad, the idea that we need to lose weight, we need to look a different way, like those are just things that don't help us. And so in everything that I'm trying to do, I'm trying to talk about what can we add to your life? How can we add to better sleep? How can we add more onto our plate that is going to get us to our goals? How can we add to how we move our body in a way? Or how can we replace maybe too? But the idea of taking things away, I'm never going to be able to eat that again. I'm never going to be able to do
mm.
that. I have to do this because someone's telling me none of that is helpful. And so I think really internalizing again this education and making positive affirmations for ourselves about what that information can do for us is really how people have success.
Mm. I agree because, till fairly recently, it's all been about denial. I'm gonna
Yeah.
deny eating that, I'm gonna deny that, but we are adding exercise. That was always
Yeah.
added. Okay,
Yeah.
so the exercise or something, but it's still almost like a punishment. "Oh, I've got to take that, run, or I have to stop eating that." But it's always been a very punitive kind of approach. Would you
Yeah.
not agree?
I do agree, especially when people are equating a calorie in and a calorie out, then often you're going to be associating exercise with an excuse to be able to put something in your body that may
Mm,
not be the best for you. And so I try to split the exercise and the food into two separate things and make sure that I'm loving and enjoying both those things. Not everyone's going to be a runner. Not everyone's going to lift heavy. Not everyone wants to do yoga, right? But some of those things make people feel amazing when they
mm,
do them, and on its own should feel like that. And the food, again, you can add to it and make it what you want with the information that you get about what nutrition really is and what your body does with it,
mm.
and create plates that are lovely, regardless of how much calories they are.
Right. You just made me realize something that when I was younger, and I won't age myself now, but that was the mindset. The mindset was, well, if I go work out for an hour, then I'll be able to eat this dessert,
Sure,
right?
I can
Right.
run a couple miles and I get to have a glass of wine. That's the way we all thought. That's what
Mm,
most people still think.
right. So let's now delve. How
Yeah.
should we be thinking?
Yeah. So I think that the choices that we make on lifestyle, like the when I'll go through these pillars that we keep alluding to, really should be oh, I hate the word should. Let me back up. We have the opportunity to use these pillars to be able to create long-term metabolic health for ourselves. And I think if we're aiming for that longevity, that metabolic health, which by what I mean is that your metabolism and your brain are working effectively and efficiently for you as you age, which is going to avoid inflammatory and metabolic things such as cancer, dementia, heart disease, obesity, diabetes, all those things we don't want.
Right.
If we have the idea that the pillars that we are going to implement into our life, that is what we are going for, it is a much more powerful why than I want the scale to say this or I want the number on my pants to say this.
Right.
It turns out you will, as a side effect, probably get to those numbers by making these choices, but it should be that, right? It should be
Mhm.
like the aim is bigger. I want to
Yeah.
be able to pick up my
Yes.
grandkids and run around and chase after them and lay down on the floor and stand back up, all those things we want to do when we're older.
Right. So it's the purpose driven. It's the purpose of
Yeah.
my purpose in this is I want to feel better. I want to not have disease.
Yeah.
And I wanna be able to keep doing things that I'm doing now that a lot of older people aren't able to do because of just the effects of their lifestyle.
Yeah. And I'm going to point out the way that you purposefully said dis-ease, right?
Mhm.
So
Yes.
what we're looking for in metabolic is ease of life and movement and our thinking and not the dis-ease of it. So
Mm.
thank you for saying it that way.
No worries. I'm a little keyed into this myself because I don't know if
Yeah.
I'm really into longevity and health, but you know that about me, right? Okay,
Yeah.
actually, I'm now on a
Okay.
mission to build more muscle because I'm getting
Yes,
older,
me
and I
too.
know that that's
Yes.
right, because the sarcopenia is one of the big 3,
Yes.
right? Okay,
Yep.
good for you.
Yeah.
Okay,
Good.
what were you
Yeah.
gonna say?
Okay. Yes. The pillars of lifestyle medicine. Let's talk about them. There's 6. Number 1, optimal nutrition. So we're talking about primarily a whole food eating pattern. And so I'm not talking about becoming vegan, although there's like great information in lifestyle medicine and preventative medicine about plant-based eating. But I am talking about here at Holist about how can you unprocess your food the best that you can, because the less processing that your vegetables, fruits, whole grains, legumes, nuts, seeds, and your animal products have, the more efficiently your body is going to be able to use them for what needs to happen. And it doesn't come with all the food science stuff that they make in the lab to make you want to buy things more. So
Right.
optimal nutrition, if it's pure lifestyle medicine, they're going to say whole food, plant-based. I like to say, let's simplify it. Let's meet each other where we are. Let's talk about if it was grown or born, eat it.
Right, okay.
uh, Not if it comes in a box.
Yeah, there's that whole argument about like, vegan versus, and some people are like, well, the vegans, sometimes their teeth aren't that good or, and then they're like, well, one of the greatest, Tom Brady, I think, is a vegan, right? So,
Yeah.
but then there's the other people that say, well, animal protein is the most dense. And so where do you, I know, and I'm not trying to get you political here, but where do you stand on all that? Because I have heard so much and I practice so many different things. I don't eat red meat, but I do eat like chicken, fish, stuff like that. Where do
Where I
you
stand
stand
on
on
it
all
is
that?
that I wish that everybody would stop fighting about it, because
Right.
there's good aspects to a lot of it. And if you do good studies on different things, you're going to get different results. I don't think it's so much as labeling each other that's important, and more just about unprocessing and being mindful about how you eat. That's the way that I think about it.
Right.
I
I
mean, I
agree.
have done I have done lots of things over my life as well. As a vegetarian for 15 years until one of my pregnancies, and suddenly I needed a hamburger. So like all things changed.
Right.
I do primarily eat plant-based, probably 80%, but that's my preference. And that's because I
Mm,
feel like it's pretty easy to be unprocessed when you're talking
yes,
about things that are grown in the ground.
for sure. And it's really hard to get good meat, right?
Yeah. Yeah.
Agreed. There's so many chemicals and all sorts of that's why I don't touch red meat. That's just
Yeah.
another whole thing. Okay. No, I agree. And I agree. They're going to stop fighting. Okay. So what's number
Yeah.
2?
Regular physical activity. So this
Okay.
is basically engaging in a consistent level of exercise, which is going to be strength training, like we just alluded to, and
Mhm.
aerobic activity and flexibility and balance. And so, do I mean that again, like, does everyone have to, bro bra in the gym with their barbell? No, it's not for everybody. It depends what your goals are. It depends your body type, depends what you love. The key to that sense that I said is consistent. So
Mm,
you need to have a pattern that feels good, that sustains you, that you want to do. But it should involve all those things. Some amount of resistance training that can be body weight, just trying to build some muscle onto your bones. So as you age, you mentioned sarcopenia, that's the loss of muscle, but also it helps your bone health. And there's great information out there for women that your grip strength is actually, as you age over 65, is associated with your longevity. So just being able to hold
mm,
things for a longer period of time. And flexibility, super important. Again, to be the ability to fluidly move your joints, and know how to do that. And you can do that in lots of different ways. That's not yoga. You can find YouTube mobility programs. You can do 5 minutes a day.
mm,
And then the aerobic activity, of course, gets you that cardiovascular health, as
right.
well as brings those endorphins to your brain for your mental health.
Mm,
You really should be getting about 150 minutes of moderate exercise, a combination of all those throughout the week. If you do things more vigorously, it can be about half of that. So that can be as much as building, a 30-minute walk in 5 days a week, with some kind of push up a hill here once in a while and some stretching. It could be as simple as that. Or 75 minutes could be 2 long runs or 2 big
mm,
weightlifting sessions, if that what you like. They do also have some data out there that there's some things called exercise snacks. So even if you just do 1 to 4 minutes a few times a day of something while you're waiting for something else to happen, that also has huge benefits in terms of insulin sensitivity and metabolic efficiency. So it doesn't have to
Right.
be really hard.
Right. Because the whole HIIT thing now, they're
Yeah.
saying that that high interval impact training is actually more beneficial than just sort of running for slowly
Yes.
for
Especially
60
for
minutes.
perimenopausal women. Yeah.
Oh, okay, cool. All
Yeah.
right. So what number are we at now?
Number 3, restorative
Okay.
sleep. So this I work night shifts in the emergency department. So this is something I'm constantly trying to work on, kind of pulling a lever of how things can be better, but basically prioritizing and achieving high quality sleep. And that's typically 7 to 9 hours for adults.
Mhm.
I'm not a sleep expert, but I do have sleep experts of my whole community for my clients. Really, this is understanding that just losing consciousness is not sleep, which
Mhm.
means, using substances, medications, those are not
Mhm.
necessarily getting you to the quality restorative sleep where you fear extinguish and work through your problems and get
Mm.
your metabolism to chill out. So that easier said than done, but very important.
There, yes. Yes, and there's actually a really good book by Dr. Matt Walker called Why We Sleep.
Oh, yes. I have heard him on some pods. That's great.
Yes.
Yeah. Number 4 is effective stress management. So figuring out how to mitigate not necessarily acute stress, because that's important for us to be able to run from the bear, but this like chronic stress of running from the bear for our entire lives really
Mm.
does cause a lot of inflammation in our bodies, and causes you to not be able to focus on kind of the social connection with yourself and others, when you're constantly stressed. And
Spinning.
so, what spinning, exactly.
Mm.
So, figuring out, is that a mindfulness practice? Is it setting boundaries? Like, what does that look like for you? And for your situation on how you can minimize that. And sometimes goes back to the other thing. Sometimes stress is mitigated by understanding you're fueling and moving yourself in a way that helps you process some of that stress. I know that if I don't exercise, whew, my stress is beyond.
Right, I'm the same. I need to
Yeah.
exercise, or I'm like, "Why am I not feeling well?" Oh, that's
Yeah.
right.
Yeah.
Okay.
Number 5 is positive social connections. I alluded to that when I was talking about the stress management. Basically, we have been able to show that the impact of social isolation and loneliness is huge on our health. And so, really fostering and maintaining healthy relationships and networks, whether that's online or in person or at your church or a group of your family members, or just like for me here, when I moved to Idaho 17 years ago with no family, my friends are my family. Like we have a
Mm.
community that like lifts each other up, and without that, it would be really hard to function as a family for sure. So those social connections are a lot more important than we used to think. It's not just you know I have some friends. It's like who can shoulder this with me, so to
Mm.
speak. And the sixth and last is avoidance of risky substances. So, trying to reduce or eliminate the consumption of substances that are detriment to our health. And so, we're talking about alcohol, tobacco, and recreational drugs, but also we're talking about, all those dopamine hits that we get, that are not necessarily something that you're physically consuming, but is it gambling? Is it unhealthy
Mm.
sex? Is it online digital consumption?
Mm.
All
Right.
those things that are dopamine hitting us so that we are not able to feel the dopamine of our regular life that we should be getting from healthy food and social connection and movement and, the belief systems that we have.
Right.
So incorporating all these for everybody is very important. And I think lifestyle medicine has done a nice job of kind of forcing us in traditional kind of Western allopathic and osteopathic medicine to have these conversations with our patients in a meaningful way that we know there's data behind it, that it will make you better. It's not just kind of woo, paying
Mm.
attention to
Right.
ourselves is important.
Right. Well, about time, I say, because,
Yeah.
I had a friend years ago who's a doctor. We're still friends, but it was years ago. And she said, we literally learned nothing about nutrition. We had one lecture, the whole years of training. She said it was literally one. She said, I was astonished. I thought we were going to learn nutrition. They didn't
Yeah,
teach it then.
that's why I went to school while I was going to school. I remember, I don't even know it was a whole lecture. I think I only learned about metabolism and insulin in a diabetes lecture.
Wow.
So It wasn't
Now,
even about nutrition.
are they changing that now? I mean, it's such
Yeah.
an obvious hole. Are they starting to
Yeah,
change that in?
they've changed the pattern of medical school to incorporate like more clinical work and more kind of lifestyle things as well. I don't
Mm,
think all schools are there, but I'm definitely hearing it.
it's bizarre to me that it's still not like it's so obvious, right? Now, the last
Yeah.
one, I was just thinking when you were saying that, that's also getting rid of toxins like plastics and mercury, of
Mm.
removing, right, with the
Yeah.
substances. That's also toxins, plastics, and stuff, and fertilizers
Yeah.
and stuff like that, right?
Yeah. Unprocessing your life, just like
Right.
unprocessing your food. Yeah.
Right. Okay. Well, thanks for all those. So those are the six.
Yeah.
Now, tell us, what is it like being? You were one of the first doctors I met. There's also a coach. I was astounded that I know it's a thing, but I didn't know it was a thing then. So,
Yeah.
what's that like? And how important is it for physicians to also be entrepreneurs as far as you're concerned?
Yeah. So, yeah, physician coaching is kind of cool right now, but it was not when you met me.
Mm,
And as I said, I've been doing this as long as I've been a doctor, so 22 years. So for me, it really went hand in hand. But I do think the ability to learn about how coaching is different than prescribing, in like the coaching of like holding space for someone and providing information and helping them work through how they want to implement that is something that is like really important to get people to make meaningful change, because again, you're not just prescribing and telling them what to do. And I'm not just talking about prescribing medicines. I'm talking about like, this is how much you need to do when, and yeah, being very specific and pushing it on them. So I think the
mm,
opportunity to learn how to be a coach has made me a better doctor, because I try to hold that space the best that I can. And emergency medicine has its time pressures, so it may
yes.
look differently in the department than it does on a coaching call, but it has helped me, I think, be a better patient, be a better doctor, be a better parent, be a
Mm,
better partner. And in terms of entrepreneurship for physicians, again, like this is something that really has been shifting in the last 5 years or so. When I first started kind of really pushing in my business in 2017, it was pretty unheard of for there to be physicians doing something outside of the hospital, outside of the clinic. I think that, you know, over the last 15 to 20 years, we've been seeing a lot of loss of autonomy as physicians. While we have not been able to run our own clinics, we've been employees of big hospital systems. The insurance companies are in between. Everybody, the administrators are in between. We've lost like a patient physician relationship, and that's been really hurtful for patients and really hurtful for physicians. And physicians are not happy, and they're burned out, and they're looking for different ways to not just supplement income, but also to like feel like they're making an impact, and
mm,
being able to take ideas that are out of the box and create something out of it, whether it's a service or a product or a community that doesn't involve all those layers of like separation,
mm,
feels really good for those of us who went into medicine because we wanted that connection and we wanted to help and we wanted to make an impact. And so I love seeing my physician colleagues doing more entrepreneurial work.
mm,
And I think it makes us better doctors too, because we can think differently than how we were trained to do or how we're being told to do. And we're
mm,
seeing this in lots of different ways in the healthcare field. Right now, one of the things our company is doing is that we are collaborating and partnering with direct pay clinics. So these are clinics, whether they're obesity medicine clinics or specialty clinics or direct primary care clinics, that have purposely removed themselves from the insurance company. They've totally opted out of insurance. And so
mm,
you can be a patient of those clinics as a member, and you have so much access and so much opportunity and so much time with your physician. It is I've been a direct primary care patient myself for the last 8 years. I have insurance. I
right,
choose to go to this type of clinic because I feel seen.
right.
Right. And I want to, and so what we're doing is we're partnering with those clinics to coach their patients to save them time, and
Mm,
have their patients come to them with more complex answers or questions in their appointments while we do kind of the baseline work for them. And I love the ability to collaborate with those physician entrepreneurs because I'm seeing that they saw this conundrum that we're in, and they're like, let's remove a whole layer. Let's go back to
Mhm.
when I got to run my own clinic. I may have a nurse and an MA, or maybe it's just me, right? And the patients come and we work together on what the problem is, and they can negotiate pretty good radiology, lab, and medicine prices. So it's really a win-win for everybody. And I love seeing that. Yeah.
Yeah, because the medicine went through a period that I noticed in my lifetime where you would go to the doctor and they'd spend time with you and they'd do what they do. And then it got to a point where it was in, out, just no listening. How you doing? And whoa, and it didn't seem like care. It seemed like just processing. It wasn't the doctor's fault, obviously, because they just got overloaded with clients, especially in New York
Yeah.
City. You saw this
Yeah.
in New York City. And then it seems like lately there's this thing of blocking more time for those appointments than before.
Yeah, it depends on what type of system that you're a patient in, right? And
Mm,
how that time is protected. And so you're right. That shift was not the doctor's fault. It also feels
no.
terrible to them.
Mm,
And they're getting double, triple booked by staff because the staff's being told that there need to be more patients in the clinic for reasons I'm sure
monetary
everyone can
reasons.
figure out. Yeah.
Yeah, yeah.
And so the move for some of these hospital systems to recognize that and to um, want to make the physicians and the patients happier is great. A lot of them are not there yet, and the move towards independent practice, whether it's out of the insurance industry or still within it, I think is a way that a lot of physicians are working to try to make that happen for themselves and for their patient communities.
Mm. Now, we were in contact because we were working together, well, during the pandemic, right?
Yes.
And there was a huge crisis, which we were talking about, obviously didn't just start with COVID, but had been coming to a head where doctors were burning out. They were kind of fed up. What's happened post pandemic? Has it gotten more in an even keel, or are doctors still just wanting to quit and feeling burnt out?
I think that period of time of, anxiety, a lot of us being surrounded with a lot of death, and poor resources, I think, just brought to light, all of the problems that had been building. I mean, for years before that period of my career, we'd all been like, I don't think anyone knows like how precarious this healthcare system is. Like what
Mm,
if people knew like how much of a mess this is? And I think that all brought it to light. And that's why you're seeing a lot of people being like, I just got to get out of here. I can't do this anymore. I think that maybe settled out a little bit. We do have, a whole generation of medical students and residents that were training during that time that are coming out, and they have a different perspective a little bit than we do. I think that people who stayed are looking for other opportunities and ways to supplement their peace of mind and their ability to help their communities, sort of like what I was commenting on.
mm.
um, I don't know if I don't know if it's better. I don't think it's
Right,
worse.
right,
I think we're
right,
still
okay.
struggling with a lot of lack of resources in the healthcare
Mm,
system, particularly staff.
right. Also, there's time resources, right? Because doctors
Yeah.
work pretty long hours and then they've got to create something on the side. I don't even know how you guys do that. Like, a lot of energy.
Yeah.
Yeah.
And a lot of us that are doing that, right? We're mid-career, most of us. And so we're the sandwich generation, right? We've got parents and we've got kids and we've got the profession and just lots of stuff, lots of
Lots
things.
of stuff. So even more need for the 6 pillars of lifestyle,
Yes,
right? To get
exactly.
that going.
Exactly.
Well,
Yeah.
Heather, this has been fantastic and it's been great to see you again, by the way.
Yeah.
What's one, you're a mom of like 2 boys, right?
Yeah.
And a wife, and you're an emergency physician, and you're an entrepreneur and coach. You got a lot going on, right? And I don't know how you do it. And
Yeah.
what's something that in all your journeys and all the ups and downs, because you've had ups and downs, um, what's one mindset or philosophy you just want to leave people with?
I think, especially, in this kind of mid-career, midlife that a lot of us are in, that we put everyone else first. And I think it's, of course, important to be serving your family and your patients and your clients and, your community, but we also need to realize that we are as worthwhile. And we can't do any of those things well unless we're caring for ourselves in the ways that we talked about here today. And so, what I always tell my clients, and how I had a podcast for a very long time, like 250 episodes. I'm currently on hold, but I used to end my podcast with this phrase every time, which was, who you choose to be matters, and you are valuable, you are worth this, and you are your whole you. And I like to tell myself that all the time, because I think that I need to see myself as I see my sister and my mom and my best friend, right? Like they are who they are, and everything that they do is valuable and matters. And I think if you can think of yourself in the same way, then you're going to choose that ability to sleep, choose the ability to move, choose the ability to feel yourself the way, have the connections you want, to avoid the dopamine hits that don't serve us.
Mm.
If you're choosing you first. And so I don't think it's selfish to think that way.
I don't either. Thanks for that, Heather. And thank you for listening. I hope you got a lot out of this episode, as I did. And we'll see you on the next one. If you liked it, please put a good review or share it. Take care. Bye. You're listening to the Business Wealth Impact Podcast, your source for empowering information and cutting-edge ideas from the world's top minds. I'm your host, Jean Amlour, founder of seven-figure coaching company, Jean Amlour International. Join me on a journey to unleash your potential and create your highest success. Welcome to Business Wealth Impact.